You can literally improve someone's cognition. You can improve someone's inflammatory state. You can help add really good functional years to someone's brain. And ultimately, if you do that, you're adding it to the full body just by employing the simple and safe modality of photobiomodulation, which is...
I'm Riley Reese. This is the Sofia Unfiltered Podcast, where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go.
All right, everyone, and welcome back to another Sofia Unfiltered. I'm Riley, your host, and today we're sitting down with Dr. Brandon Crawford. He is a pioneer in brain healing using revolutionary laser therapy. Dr. Brandon, welcome to Sofia Unfiltered.
Thank you so much for having me. I'm excited to talk to you today.
Yeah, likewise. So, neurologist, you've been studying the brain. I can't wait to jump into all of this. But for our listeners, can you just really start with what is functional neurology?
Oh, okay. So that's a great place to start. I just actually presented this topic at a conference in Atlanta that we hosted. Functional neurology is still a rather young profession. It actually started back in the late 1980s. It's really based on Dr. Sherrington's work. He actually won a Nobel Prize back in 1932, I believe. And it's based on what's referred to as the central integrated state of the nervous system. And the short version of this is basically think about when you turn your car on and it has that idle state, right? So you're not pushing the gas, it's idling. Your brain has that capacity too, right? So we have this idle capacity, and a neuron or a group of neurons has to come to threshold in order to fire to then produce a function. So that firing rate is going to be dictated by the central integrated state of that neuron or the network of neurons in question. And so functional neurology is really dealing with these, what we call functional lesions or functional disconnections within the brain. And so if, there's someone has a problem and there's not an ablative lesion, meaning like an acute stroke or a tumor or something like this is where we step in. This is where we come in and we go, okay, here's how we're going to develop neuroplasticity, positive neuroplasticity, so that we can remap the brain, we can establish new connections, whatever it may be for that individual. So we are neuroplasticity experts. We are really looking at how to improve and sustain positive neuroplasticity within the brain and the nervous system. That's a very short description, but I hope that kind of helps.
No, and it absolutely helps. And I think my next question would be, so if you're a neuroplasticity expert, what does that mean to me? The average, I say customer of yours, right? What does that mean to me that you can improve my neuroplasticity?
Yeah. So again, phenomenal question. What we need to understand is that everything about us, every part of life, is actually going to have something to do with neuroplasticity. We have negative plasticity and we have positive plasticity. So let's just take this example. The alarm clock goes off. I hit it. I go, crap, I got to do this again. I had to go into the same job, the same person I don't like to talk with, whatever, right? If that's how you start today, you are developing neuroplasticity, right? You are developing what I would say is a negative plastic response. You're setting in motion a certain set of neurochemicals, firing certain neural pathways within the areas like the limbic system and the prefrontal cortex. Really, you're setting the tone for your day and you don't even know it, right? Versus, let's just create a positive neuroplastic experience. And positive neuroplasticity typically is going to require more effort. You have to overcome something, right? You have to actually try and have this targeted thing that you're trying to achieve. So our alarm clock goes off. You don't like doing what you're about to do, whatever, but you hit the alarm and you go, I'm thankful for today. I'm going to be able to expand my territory. I'm going to be able to have new opportunities. I'm going to be able to whatever it is, right? So you're trying to create this positive neuroplastic event in your life. Now, if we shift into the clinical realm, right? So I see a lot of brain injuries. So if I have someone that, let's say they're 5 years or 10 years out after a brain injury, and they come in and there's all of these muscular changes that have occurred. Let's just say the arm is in this contracted position. So I'm sitting here with a flexion dominant arm. I have a cortical fist. That muscle tone is generating negative plasticity within my brain. So my brain is setting a sensory map and a motor map based on what the muscle spindles are feeding into my brain. So the longer I'm in this position, the harder it is going to be to overcome it, right? So that's negative plasticity. So now I, as a provider, have to come in and go, okay, how can I create enough positive plasticity to actually get that person to open their hand and move their arm? So it's doable, believe it or not. So I can generate that type of response in the individual. Obviously, the more negative plasticity there is, then the harder it is and the longer it may take, but it is possible, right? So does that help?
Yeah, absolutely. It's super interesting. And I think this is incredible, right? So I'm a veteran. We have a lot of veterans listening in. And I think this is really interesting also in like the TBI space, like the traumatic brain injury, or people who may have endured explosions, like, because you're talking about physically changing, right? Some of the structure of your brain and what that's going to do to you long term. I guess my question, what I'm really interested in, I know we spoke a little bit about this at the beginning, is what can we do with this on mental health, right? What does this look like, the neuroplasticity? You mentioned what we tell ourselves is creating neurons and pathways, right? This is good for better or worse, right? So if we're telling ourselves negative things, we're going to start creating more of that, I guess, the rhetoric that we're hearing in our head. I mean,
Right.
Can you go into that, elaborate a little bit
Yes.
more on that, a little bit on the mental health side?
Absolutely. So something that's exciting right now is we actually had various government officials reaching out to us from Australia, from the mental health space, specifically wanting to take our work and further it there because of, they saw how we work with autism and neurobehavioral disorders. And then I think they heard some lectures that we gave specifically talking about anxiety, depression, that type of thing. So there's multiple ways to kind of navigate this discussion. And I think one way to kind of ground it in science is like this. Are you familiar with Stephen Porges' work on the polyvagal theory?
No.
Okay. So Dr. Stephen Porges, he's a pediatric cardiologist. And he wrote a phenomenal book, by the way, if anyone's interested, called The Polyvagal Theory. And if you look into this, you'll know that what we're taught in, whatever schooling you went to, whether it's medical school, biology, whatever, everyone's going to be taught that there's a parasympathetic and a sympathetic response, right? You have your parasympathetic, which is your rest and digest, and you have your sympathetic, which is your fight or flight. Well, he actually, by studying sudden infant death syndrome, he actually found that, the parasympathetic state is actually divided into two different parts of the nervous system. You have your dorsal vagal complex, which is the oldest unmyelinated type of the parasympathetic nervous system. It's connected to what's called a fear paralysis reflex. And then what happens is we should develop that, right, while we're in the womb. And then when we're born, we're still more dominant in this dorsal vagal complex. And it makes sense because when we're born, we're a baby. We're not able to really voluntarily move or fight or anything like that. And so what happens is we then develop our sympathetic nervous system. And our sympathetics are going to be more connected with a reflex called the Moreau. It's also the fight or flight. And so now, instead of using that fear paralysis, which shuts us down, feigns death, plays possum, right, for safety reasons, let's run away or fight. And then what should happen is we should then develop the newest part of our parasympathetic nervous system. This is called the ventral vagal system. And this is largely connected to an area called the nucleus ambiguus. And this is connected with cranial nerves 5, 7, 9, 10, and 11. That's important for the clinicians out there because it gives us a window in to examine and to treat this area. But the ventral vagal system is really connected to social engagement and safety. And so it may kick on and say, hey, instead of running or fighting, that individual is not really trying to hurt us. Let's reason. Let's read their facial tone, their intonation, their nonverbal communication, etc., and really engage them differently. Right now, what happens is we get this sequential degradation that occurs. So if we don't have a properly developed ventral vagal system, or it's been damaged because of brain injury, we'll default into that sympathetic tone. Now we're stuck in a fight or flight mechanism just from minor stimuli. So we can have a sound, a flash of light, some kind of minor stimuli that we're not even conscious about, and it can be firing our fight or flight mechanism, right? So this person is going to be running around with anxiety, with elevated heart rate, respiration, just this feeling of like dread, like what's going on, and they don't even know why. They don't know why they feel this. If this continues, or if there's other types of dysfunctions present, then you'll default into the dorsal vagal complex. This is the shutdown state, right? So now that person's going to switch. They're going to have this just unrelenting anxiety that is just heavy. They don't know where it's coming from, but it's shutting them down. They want to withdraw, right? This is where a lot of depression lives, right? So this person is shutting down. I've actually had people go into multiple systems atrophy where literal organ systems are beginning to shut down because of this. And so what does this present like? Well, this is presenting like PTSD. This is presenting like depression. This is presenting like anxiety. This is presenting like a chronic pain disorder, dysautonomia, you name it, right? So the mental health conversation really needs to kind of start there, right? Now, from there, we can go into the prefrontal cortex and how that is going to come in and gate the amygdala. And then we can talk about the vestibular system and how it also gates the amygdala, et cetera. But that's kind of the groundwork for that mental health discussion from a neuroplasticity and from a functional perspective, because along each one of those paths, right, the dorsal vagal, the sympathetic, the ventral vagal, prefrontal, vestibular, amygdala, all of these areas, there's different ways to leverage neuroplasticity and develop or integrate, whatever is damaged or dysfunctional, so that we can actually move someone from that depressed suicidal state or that severely anxious state and get them into a different part of the nervous system so they're not experiencing those symptoms anymore.
So this is amazing, right? And it also sounds to me like because of this, one thing that's actually standing out to me is how in the world are we going to find out, with what 50% of people having some kind of symptoms of depression? How are we just doing pills? And of course, our platform at Sofia Health, you can find different types of practitioners, but how is somebody supposed to find out if this could be possibly something that is affected and could be what's going on? Or better yet, do people just say, hey, I've been diagnosed with depression or anxiety. I would like to come off of a pill. I need to find Dr. Crawford. Like, how does this is amazing. How does this work?
Yeah, well, we're doing our best to expand our reach as quick as possible. And again, functional neurology, and I've actually been able to create even just a different branch of functional neurology that incorporates different types of technologies and modalities to accelerate healing and to accelerate neuroplasticity. And we are actually doing some extremely exciting research projects right now that dovetail into the regenerative medicine field. Things like looking at how laser therapy actually impacts various types of stem cells and the receptor proteins on these stem cells to actually activate them and actually guide them. So that's one research project that we have going on. But as far as going back to your question, so I'm located outside of Austin. I do have an office that we opened in Atlanta. I have a business partner in Louisiana, and we're opening a clinic right now in Dubai. We've had some initial discussions with some healthcare authorities here in the States. It's definitely more difficult, I will tell you, because we've had various conversations. Everyone's like, oh my gosh, this is amazing. And we go up and we go up, and then all of a sudden it's like crickets. It's like we stopped getting communication here in the US. In Dubai, actually, so I met with the Ministry of Health twice now. They're very open. They want this included in their hospital systems. So the plan there, once we open the private clinic, is to actually begin the conversation of, okay, how do we implement these different strategies and modalities within their mainstream medicine? Because it should be. It's safe. It's effective. There's no reason to exclude this. The studies have been done. This is all evidence-based. This is not, junk science. In fact, I believe when I go there in July, I even have a meeting with the Ambulance Association. They want to know how they can implement lasers, vagus nerve stimulus, and trigeminal nerve stimulus while they're going to the hospital with someone that has a mild to moderate brain injury.
Oh my
Because
gosh,
there's
incredible.
studies that I can show you that says you should do that. So, I mean, why aren't we doing this in America? I don't know. That we really need to ask that question. But I promise, we're doing everything we can to accelerate that process. In the meantime, if someone has a need and, they want to see if this is, something that can help them, I would just encourage them to, reach out to one of our neuro solution clinics. And if, we can't get them in or they're too far away or whatever, we'll try our best to locate someone that can help them, in whatever scenario it is.
No, that's amazing. So I see two things here, just based on what you're saying. Is one is, a patient who's possibly presenting with a mental health issue, or hey, I had TBI. I kind of want to look and see what the other solutions are. Or they, like I said, depression, anxiety. But the other one is, what if you don't have that? Because I also see this is like, you're talking about stem cells. We're talking about tapping into your brain's potential. So are we talking about just for the everyday use? There's things that we could be doing to kind of improve our brain function
Yes.
as well?
Yes, absolutely there is. In fact, there was a study I was just reading not too long ago. It was published in 2021. It's called Photobiomodulation and the Aging Brain, I believe is what it is. It was the research authors were Cardozo, Lima, and Silva. But this was a really cool study. They were literally just looking at it from the perspective of, can we leverage something like photobiomodulation, which is using laser or light therapy on, I'm going to talk about photoneuromodulation, which is on the brain. But this is looking at how using laser and light therapy on the brain actually can enhance cognition. It can modulate neuroinflammation. It can help modulate neurotransmitters. Going back to the mental health discussion, you can literally modulate, meaning you can balance neurotransmitters by using laser light therapy.
And the neurotransmitters means what for the mental health space?
So that would be things like dopamine, serotonin, norepinephrine, GABA. So each of these neurotransmitters is associated with a different mental state, if you will, right? So dopamine is more connected with joy and pursuit and motivation, et cetera. So each of these neurotransmitters has been associated with a different type of clinical presentation, right? So if you present with low serotonin, that's typically the depressed individual. You can also have low dopamine in someone with depression, but that one's a little more severe. They're not motivated to get better. They don't want to get up and move, etc. So each of these neurotransmitters will present with a different mental health picture. But literally, studies that show photobiomodulation can safely and effectively modulate these neurotransmitters. But then also, from an electrophysiological perspective, we can actually change someone's brain waves by pulsing light at a specific wavelength into the head. I've done a pilot study on it. We didn't publish that because there's IP that we need to protect. I actually spoke with Dr. Berman just yesterday. He's the founder of the Quiet Mind Foundation, and about a product that he's developed and the research that he's done and doing. So you can literally improve someone's cognition. You can improve someone's inflammatory state. You can help add really good functional years to someone's brain. And ultimately, if you do that, you're adding it to the full body just by employing the simple and safe modality of photobiomodulation, which is
But you also mentioned, it's very impressive, but you mentioned inflammation. Are we talking, we're talking the same inflammation that could possibly be causing and driving all of the chronic disease. Is that what we're?
Absolutely.
Oh my goodness.
Yes. And then going.
Why would somebody say no to this? This sounds like, except unless this sounds like, how do you get the laser in? What does that treatment look like? Of course we have all the questions.
Right. Yeah. So why would someone say no to this? I don't know. I literally don't know. When you look at the safety profile and when you look at what can be done with this therapy, I don't know why someone would say no to it, just to be honest, because there's thousands of research studies that have been done proving its safety and efficacy.
How do you get the lasers into the brain? Can I just ask that really fast? Because we have face lasers, people are using lasers in the dermatology area all day long. So this seems like
So,
easy.
right. So it's not a simple answer, but I'll answer it like this. So yes, you have this skull. Okay. So everyone thinks, okay, lasers are not going to penetrate the skull or light's not going to penetrate the skull. But that's not actually true because we actually have receptors for light all over our body and inside of our body, and they're called chromophores. Think of them like solar panels. So solar panels are going to capture photonic energy, capture photons, light energy, and transmit that into electrical energy. So we have this going on in us, in every cell. And so the skull is living tissue. It has chromophores. So that light is going to hit those chromophores. That energy is going to be transmitted. So number one, will you have less penetrance into the brain? Sure, of course you will, but you're still going to have penetration into the brain. Studies confirm this time and time again. But you also have vasculature going between the skull, between the bones, through the dura. So you're actually doing what's called blood illumination. So when I'm lasering an area of the brain, I'm actually lasering the blood that's then feeding directly into the brain. And so you're getting all of these other effects from the blood illumination going straight into the brain region. So it absolutely does penetrate the skull. Now, what I would also say is this: laser beams or LEDs, laser and LEDs, they're like voices. Okay. So if I'm sitting here talking to you and I scream, anything, but how are you? I'm just screaming at you. How are you? Right. Versus I'm just talking to you normally and I say, how are you? Or I speak to you very soft and sullen, like, how are you? 3 different biological responses in you from the same words that I spoke. Okay. So same words, different biological responses based on my intonation of voice. Laser beams are the same way. So it's not just about pushing photons. There's various aspects about a laser beam or an LED panel, right, that you can control that's going to dictate what type of response you get. For example, I have a certain laser that speaks specifically to the surface receptor proteins of stem cells to activate them, the V cells specifically. Well, if I'm just using that for therapy, if I'm trying to drive, a functional imbalance in the brain, I don't use that laser because that's not what it was created for. It's not what the beam's for. The laser beam I've created is actually designed to talk to these different areas in the brain or the body, the organs or whatever, based on the laser beam that it produces for that specific setting, right, to generate that different biological response that we want, right? So the laser or light device does matter. However, you're going to get benefits no matter what you're using. But if you want these really precise benefits that, I'm looking at generating, we do need to pay attention to what we're using.
Yeah, this is amazing, right? Especially in the dermatology space, we already know there's different lasers for different, do you want to get rid of wrinkles or do you want to remove tattoos? There's different frequencies. So you actually developed the laser, or did you just put or because the laser exists and you just said, hey, this is what actually gets the result we're looking for? I mean, this is incredible.
Both. So I wanted to develop lasers, 5 or 6, if not 7 years ago. And my wife said, no, we're too busy, not doing that. We had just moved back from Costa Rica. We did a sabbatical in Costa Rica. I thought I was going to retire back in the day. That didn't work. God said, no, I have other plans for you. But I wanted to develop lasers then. And it's not that she just didn't want to, it's that life was too crazy and it wasn't feasible. So I looked at all different lasers on the market. I found the one that I thought was best. And we've been running with that. But over the past couple of years, I just noticed all these different gaps, right? Science and technology was exploding. Laser therapy technology was not in the therapy space. And so, I reconvened with my wife. She's my business partner in everything that I do. And honestly, we prayed about it. And literally that very next day, I was meeting with a patient whose dad is a software engineer. We'd known each other for a long time, coached baseball together and everything. And he actually came to me and he was like, hey, I just feel the need to tell you, like, we should develop something together. I don't know what it is, and I was like, seriously? And so we partnered, and over the past year, we've developed this new line of therapy lasers that actually launches this month.
That's incredible. So is it something that we can purchase, the consumers are going to purchase? Are we going to be selling this on Sofia Health so we can get these lasers and do this in our homes? Is that what we're talking about?
Yes, actually, because so many of my patients will come in, they'll get care, and they just say, "Look, we've gotten so much better. Is there any way to do this in the home too?" And so we've had to create this laser system with that home user specifically in mind. And so it has the best user interface. It has programs that'll help walk you through how to use the product, etc. So yes, if you can check it out at 528innovations.com, so 528innovations.com. And yeah, we should, so come up with some type of collaborative effort together
Yeah, absolutely. Yeah.
to help. Yeah.
So, I mean, this is kind of like, okay, you can get the red light therapy to help with aging, or we can get Dr. Brandon's laser and we're talking about the benefits. And I know you mentioned longevity, right? Which is amazing, but I'm talking selfishly for me right now, right? Is this something that I could get and just do once a day, once a month, which would be amazing
Yes.
if I don't have to do it that often. And then really just, is it like a serotonin boost? And I know I'm helping inflammation as well. I mean, I'm drinking all the turmerics and all the things, but this would be Saturday morning. You get up, you just sit in the laser for a little bit. What does this look like? This is so fascinating.
Well, I'm right there with you. And so the answer is yes to all of that. So, I love the various ways that people use our lasers. Me personally, I'm going to use a laser, number one, when I first wake up in the morning. Now, we have to understand that when we first wake up, our lymphatic system has been active all night. It's been sweeping out all the trash and debris and inflammation for the brain. That's when our creative thinking happens, is first thing in the morning. So I wake up first thing in the morning, and I'm going to put on, if I'm doing some really deep meditative thinking, I'm going to use a delta wave. If I'm planning my day and really trying to organize and structure and that kind of thing, I'm going to use a low beta or a sensory motor rhythm. And I'm using that on my brain either while I'm thinking or before I'm thinking to actually improve cognition. I'm going to use it in the car while I'm driving to work. I'm going to use it on a beta wave typically, just to, again, get my brain awake and fired up and okay, I'm ready to go, that kind of thing. I personally use it for my thyroid. I've got primary hypothyroid coupled with a raging Hashimoto's that I've actually been able to put into remission. And so,
Many, I mean, you just glazed over this, but there's so many people struggling with Hashimoto's and thyroid issues.
I know.
This is a really big
It's
deal.
crazy. It is. And so I'm not saying it'll work for everyone, but it's worked for me.
Right.
And so I'll laser my thyroid. I try to do that every day. Sometimes I get busy and I don't. I also struggle with some low testosterone issues because of a baseball injury I actually sustained a long time ago. And so, interestingly enough, I actually found this to be quite interesting. I would, take various supplements and I've never done exogenous testosterone. I'm 38 years old. I'm not ready to go down that path. I've done various peptides. I've done all types of things. And what I'd say is it kind of props up my testosterone a little bit, right? But as soon as I stop taking it, I lose the benefit. If I laser, right, and I'll laser my testicles at night before bed. If I do that and I do it consistently, it will literally double my testosterone. And that to me was like so amazing, right? I was like, wait, so I don't have to constantly take something. I can reduce my peptides, which those things get expensive. And it's going to prevent me from having to get onto exogenous testosterone for as long as I possibly can. I want to try to not do that personally, but obviously it's there as an option. So, those are ways that I use it. I also use it after I get out of my cold plunge. If you're familiar with cold plunging, you get this big spike of dopamine afterwards. And so I personally am going to leverage that to build neuroplasticity, going back to what we first talked about. So after I get out of the cold plunge, I'm going to use a laser on my brain to leverage the neuroplasticity from that big spike of dopamine. So just stuff like that, right? So there's so many different ways that you can use it. And again, we're doing our best to take all these things from my brain and put into the laser to walk someone through how to use the laser in various scenarios. So, yeah.
I mean, you just started lasering all the parts of your body. So this is something, I thought this would be mental health. Okay, we'll keep it there. We'll talk about, the brain and the brain for inflammation. But this is like, oh, I have a sore knee. I'm going to get my laser out, switch the light, and maybe put it on my sore knee from running. We're talking, what? Okay, so does your laser come with instructions? Okay, for pain, use this light level. What does this look like?
Yes.
Okay.
So Yes. And so that's the part that is taking kind of the longest to build out on my part, because when I first put, like my first program together, we're calling them programs. It had like multiple steps and all these different things. And my partner was like, okay, we need to pare this down a little bit. And so that's a challenge for me, is taking all of these things and saying, okay, for this condition, do X, Y, and Z. And I also had to play this game, with the FDA of what I can and can't say. So we're still navigating that to the best of our ability. We want to make this as functional and versatile for someone as possible, right? So that's really what we're still trying to do right now. But yes, we want to give how to use it in all these different scenarios to everyone.
Yeah, that's incredible, right? Just seems like the go-to tool that everybody actually should have. I mean, I'm saying
so.
The bathroom, right? Just like, okay, you need to use soap and shampoo, and now you're going to need this type of, light therapy. What is this light doing? I know we talked about this a little bit, but can this help you sleep better? How can we use this to really get quality sleep?
It can help you sleep better. Obviously, there's various things that can be causing sleep disturbances. One thing that I would argue is that we're actually mal-illuminated right now in our society. I personally think of light as a nutrient. And if you think about it, life cannot exist without light. And no matter what the school of thought is, right? If you're faith-based, God created light before life. If you're not faith-based, well, the Big Bang Theory happened, and that, you had light before life. Either way, light preceded life. So it is a nutrient. We do need it. What happens when the sun goes down? It's going to have a huge impact on how you sleep. Our brain is not wired so that we continue to have this high frequency stimulus shining through our eyes or even just through our skulls after the sun goes down. So after the sun goes down, I'm going to be using an infrared wavelength, which is not visible to the human eye. I'm going to be using it on my gut. I'll be using it on various parts on the head, and that is going to help to guide me into sleep. A lot of people like to use like a meditative practice. They'll use like the brain tap or something similar. This can enhance that type of meditative practice. What I don't want people to do is use a really bright LED panel or the bright laser right before bed, because even that intensity of the red light can still disrupt the circadian rhythm. So yes, it can absolutely help with sleep. And I do have a sleep protocol, if you will, to help people get to sleep. Interestingly enough, you heard me talking about the glymphatic system. I was working with a nonverbal autistic kiddo, and his dad was a doctor. And he said, what if I just leave the laser on my kid all night? And I was like, well, I can't advise that. Never been done. I don't have literature that would support it. So, I can't really recommend it. Well, he did anyway. And literally he contacted me not too long after that. And the kid started to speak. And he said, it was from that. Now that, that's a N of one, it's not like I can go out and just start telling people to do that. But I do know that laser therapy does improve lymphatics, just like it improves lymphatics in the body. It helps modulate that inflammation that should be, being restored at night. It should be being washed away at night. So I know that it can absolutely have a huge impact on sleep, in the lymphatic system, neurotransmission, and neuromodulation while someone sleeps. So it can be huge.
So you mentioned that you're working with twice now. I think you've mentioned autistic patients. What are you doing specifically for the autistic babies out there?
Yeah. So in functional neurology, we would actually be classified more as developmental functional neurology.
Mm-hmm.
And so what that means is we acknowledge that the brain has a certain blueprint for development. We know this is solidified. This is not theory. We know a baby has to crawl before they walk, and they have to hit these certain milestones, etc. Well, those milestones correlate with the brain network maturation and development. And so this is true for everyone. This also does not really stop in childhood. It's not like all of a sudden, oh, we're done with milestones, we're fully grown and developed and whatever. And I can point to various types of literature that would tell you the prefrontal cortex is not really fully developed until maybe age 25. I'll argue that in a man, it's really not really developed until 35 or 40. You can ask my wife about that, and it obviously depends on the man. But beyond just this brain growth and development, it's actually becoming more and more efficient through its networks, right? So it's becoming, this network of maybe, as we're developing, we're more hemispheric, and the right brain is doing more of these things, the left brain's doing more of these things. But as we age, and this is called the Herald model, and there's also another study that looked at this, but these networks that were more hemispheric actually are becoming interhemispheric. So what's happening is the brain is gaining efficiency. Anyway, what we can do is we can apply this to the autism world. We can examine someone. If we know how the brain's supposed to develop, we can examine someone and see where they're at in that developmental trajectory. And from there, we can just start applying therapies. Maybe they need to start with primitive reflexes, or we need to affect their vagal system, like what I referenced earlier. Maybe we need to work on their core stability, their postural reflexes, vestibular imbalance, their eye movements, whatever it is. But we apply that into that developmental strategy. Side note, this is also true for brain injury and for all the things, because if the brain is injured, well, it's not like it just gives up, right? The brain goes back in time and says, okay, I need to walk again. What strategies, what blueprints did I use in order to learn how to walk as a baby? So it starts to use those same blueprints that it used back in the day as a baby. And so we as providers can then, in the developmental functional neurology world, we can examine that person just like we look at an autistic kid, just like we look at an ADHD kid. We can look at the brain injury and go, okay, well, look, you have these primitive reflexes and you have these muscular imbalances and you have, right? And then that exam then dictates the care that is provided. So it's pretty cool. I love functional neurology. I love developmental functional neurology just as much as I love photomedicine and photobiomodulation. So I just, bringing those two together is like, maybe we could talk all day about it.
Yeah, this is incredible. And I guess, even from all of our listeners out there, we should just be thanking your wife that she, didn't let you do that retirement, gig, because, this is pretty amazing. I can see why you're called the brain healer. This is because this is just, all around, right? From mental health and chronic disease and developmental issues to all the way down to traumatic brain injuries. I mean, you can really help people and really make a big impact on their lives. And I think that's just absolutely incredible. And I also can't wait to see what the impacts are just for, the regenerative and the, making the brain more efficient. That sounds really exciting to just kind of take care of your brain health and stay in that tip top shape. We take all the vitamins and supplements in the world, but if we can actually get to the root and make these fundamental changes, I think that'll be interesting. What does that look like on the long term on a lot of these dementia and, just pretty much all of that. I mean, I'm sure I'm excited. We could spend a whole topic probably talking about just those issues alone, but.
Absolutely. Always, something that popped up that came to mind. I have a colleague, she's a clinical psychologist, Dr. Jerry Levine, and when she starts talking about laser therapy, she always says, everyone thinks that when I start working with them, we're going to talk about their mom, but instead I put a laser in their mouth, right? So it is true. We have these foundational problems, and a lot of them have a lot of similarities between all of these different conditions. Nutrition is so important and lifestyle is so important, but we need to start looking at how we were designed to live, right? We're not designed to sit under fluorescent lighting all day. We're not designed to be withdrawn from society and on a phone all day. We are not designed to communicate through a social media platform. In fact, that social media platform is specifically designed to get you addicted to it. And I can speak to that personally because I was asked as a consultant to get people addicted to an app. And I didn't do it, but I was asked to do that. So if we then start to have these chronic health conditions, which we have, they're skyrocketing. You look at cancer, heart disease, mental health, you name it. We have to go back. We have to go, man, how are we designed to live? How do we get back out into the sun? How do we leverage things like light to establish positive neuroplasticity faster, to overcome the negative plasticity that we've been developing over the past 10, 20, 30, 40 years. Because time is of the essence, right? If you're 60 and you've been living poorly for 40 years, well, I can tell you to go get in the sun, I can tell you to detox and all these things, but we might need to use something like lasers to get you there faster, right? So that's my thing, man, is how are we supposed to live and how do we get someone there back into that paradigm as fast as possible to give them as many functional years as possible?
Yeah, that's incredible. And Dr. Brandon, thank you so much for your time with us. Before you go, we do ask all of our guests on the show if they could please share 3 fundamental pillars that contribute to your well-being.
Absolutely. Okay. So it's hard to just name 3. All right. So you heard me talk about lasers. Okay. So I literally do though. If I don't use the lasers, you heard me talk how I use it for testosterone, for thyroid, for brain health, etc. If I don't do that, I'm not going to be functioning optimally. So that is absolutely something that I do every day. I have to make sure that I spend adequate time with my family, my wife, my kids. If I don't, I don't do well. I don't do well spiritually. I don't do well mentally, right? That has to be a key component about, living for me. It has to happen. And then the other thing is kind of a hard one, right? Because I love being active, but I love my cold plunges as well. And so maybe I'll just combine them in my third answer and say, I love going on long runs. It gives me the opportunity to actually clear my mind and think. And then as soon as I'm done going on that long run, and when I say long run, what I try to do is I push myself to where I start to see spots, right? It's almost like I'm beginning to pass out. Now, I'm not saying people need to do this. This is just this is what I do. And I come back and I get right into my cold plunge. And if I do that, I'm like a whole nother person. So those are my 3.
Oh, that's awesome. And Dr. Brandon, where can our listeners connect with you? How can they find out more about your lasers? I'm assuming if it's not cleared yet, we need to sign up for an email list. Where can we get in touch and find you?
Absolutely. So Instagram is probably the best platform. So my handle is at B as in boy, my last name Crawford, CREWFORD, and then D as in dog, C as in cat. So at B Crawford DC is my Instagram handle. I do have a personal brand webpage, so that's drbrandоncrawford.com. So drbrandоncrawford.com. From there, you can find my clinic, you can find my podcast, you can find all kinds of things. My clinic website is neurosolutionatx.com. And I think if you can jump on any of those platforms, you'll be able to navigate all the different things. The new laser is 528innovations.com. So 528innovations.com for the new lasers coming out.
Well, there you have it. Get in touch with Brandon if you want to get on the waiting list for the lasers or get access or get in touch with him. Dr. Brandon, thank you for being here and sharing this insight into a new realm of healing beyond medication. I think this is incredible.
Absolutely. Thank you so much for having me.
Thanks so much for listening. This has been Sofia Unfiltered, a podcast by Sofia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Reese. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.